Anatomy, the study of the structure of the body and its parts. Physiology, the study of how the body functions and its various processes. Pathology, the study of diseases, their causes, and effects on the body. Pharmacology, the study of drugs, their properties, uses, and effects on the body. Microbiology, the study of microorganisms and their effects on health and disease. Immunology, the study of the immune system and its response to pathogens. Epidemiology, the study of patterns, causes, and effects of diseases in populations. Radiology, the use of medical imaging techniques to diagnose and treat diseases. Cardiology, the study of the heart and its diseases. Neurology, the study of the nervous system and its disorders. Gastroenterology, the study of the digestive system and its disorders. Dermatology, the study of the skin and its diseases. Oncology, the study of cancer and its treatment. Endocrinology, the study of hormones and their role in the body. Hematology, the study of blood and blood disorders. Pulmonology, the study of the respiratory system and its diseases. Nephrology, the study of the kidneys and their disorders. Obstetrics, the branch of medicine dealing with pregnancy, childbirth, and the postpartum period. Pediatrics, the branch of medicine dealing with the medical care of infants, children, and adolescents. Orthopedics, the branch of medicine dealing with the musculoskeletal system and its disorders. Ophthalmology, the study of the eyes and their diseases. Otolaryngology, the study of the ears, nose, and throat. Psychiatry, the branch of medicine dealing with mental disorders. Urology, the study of the urinary system and its disorders. Anesthesiology, the branch of medicine dealing with anesthesia and pain management. Cardiac surgery, the surgical treatment of heart diseases. Plastic surgery, the surgical specialty focused on reconstructing or altering the body's appearance. Radiography, the use of X-rays or other imaging techniques to create images of the internal structures of the body. Electrocardiography, ECG, the recording and interpretation of the electrical activity of the heart. Histology, the study of the microscopic structure of tissues and cells.
31. Radiography, the use of X-rays or other imaging techniques to create images of the internal structures of the body. 32. Electrocardiography, ECG, the recording and interpretation of the electrical activity of the heart. 33. Histology, the study of the microscopic structure of tissues and cells. 34. Pathophysiology, the study of how diseases or injuries disrupt the normal functioning of the body. 35. Anesthesia, the use of drugs to induce a loss of sensation or consciousness during medical procedures. 36. Epidemiology, the study of patterns, causes, and effects of diseases in populations. 37. Biostatistics, the application of statistical methods to analyze biological and health-related data. 38. Hematology, the study of blood and blood disorders. 39. Genetics, the study of genes and heredity and their role in health and disease. 40. Pharmacology, the study of drugs, their properties, uses, and effects on the body. 41. Virology, the study of viruses and viral diseases. 42. Microbiology, the study of microorganisms and their effects on health and disease. 43. Immunology, the study of the immune system and its response to pathogens. 44. Neurology, the study of the nervous system and its disorders. 45. Cardiology, the study of the heart and its diseases. 46. Gastroenterology, the study of the digestive system and its disorders. 47. Dermatology, the study of the skin and its diseases. 48. Endocrinology, the study of hormones and their role in the body. 49. Nephrology, the study of the kidneys and their disorders. 50. Rheumatology, the study of disorders and diseases affecting joints, muscles, and connective tissues. 51. Pulmonology, the study of the respiratory system and its diseases. 52. Oncology, the study of cancer and its treatment. 53. Pediatrics, the branch of medicine dealing with the medical care of infants, children, and adolescents. 54. Obstetrics, the branch of medicine dealing with pregnancy, childbirth, and the postpartum period. 55. Geriatrics, the branch of medicine focused on the health and care of elderly individuals. 56. Orthopedics, the branch of medicine Dealing with the musculoskeletal system and its disorders. 57. Ophthalmology, the study of the eyes and their diseases. 58. Otolaryngology, the study of the ears, nose, and throat. 59. Psychiatry, the branch of medicine dealing with mental disorders. 60. Urology, the study of the urinary system and its disorders.
61. Oncogenes, genes that have the potential to cause cancer when they are mutated or activated. 62. Antibiotics, medications that inhibit the growth or destroy bacteria, commonly used to treat bacterial infections. 63. Antiviral medications used to treat viral infections by inhibiting the replication of viruses. 64. Anticoagulant medications that prevent blood from clotting, used to prevent or treat blood clots. 65. Antidepressant medications used to treat depression and other mood disorders by altering neurotransmitter levels in the brain. 66. Antihistamine medications that block the effects of histamine, commonly used to relieve allergy symptoms. 67. Antipyretic medications used to reduce fever. 68. Analgesic medications used to relieve pain without causing loss of consciousness. 69. Anti-inflammatory medications that reduce inflammation and swelling, commonly used to treat conditions such as arthritis. 70. Anemia, a condition characterized by a decrease in the number of red blood cells or the amount of hemoglobin in the blood. 71. Hypertension, high blood pressure, a condition in which the force of blood against the artery walls is too high. 72. Diabetes, a metabolic disorder characterized by high blood sugar levels, either due to inadequate insulin production or the body's inability to use insulin effectively. 73. Asthma, a chronic respiratory condition characterized by inflammation and narrowing of the airways, leading to wheezing, shortness of breath, and coughing. 74. Stroke, a sudden interruption of blood supply to the brain, often resulting in neurological damage or death. 75. Myocardial infarction, commonly known as a heart attack. It occurs when blood flow to the heart muscle is blocked, leading to damage or death of the heart tissue. 76. Osteoporosis, a condition characterized by decreased bone density and increased risk of fractures. 77. Arthritis, inflammation of one or more joints, leading to pain, stiffness, and decreased range of motion. 78. Dementia, a progressive decline in cognitive function, including memory loss, reasoning, and communication skills. 79. Allergies, an exaggerated immune response to substances that are typically harmless, resulting in symptoms such as itching, sneezing, and hives. 80. Metabolism, the chemical processes that occur within an organism to maintain life, including the conversion of food into energy and the elimination of waste products.
81. Cholesterol, a waxy, fat-like substance found in the body that is essential for various cellular functions, but can contribute to heart disease when levels are elevated. 82. Immunization, the process of stimulating the immune system to produce an immune response and develop immunity to a specific disease. 83. Anaphylaxis, a severe and potentially life-threatening allergic reaction that can cause difficulty breathing, low blood pressure, and loss of consciousness. 84. Biopsy, the removal and examination of a small sample of tissue from the body to diagnose or monitor a condition. 85. Electroencephalogram, EEG, test that measures the electrical activity of the brain to diagnose and monitor conditions such as epilepsy and sleep disorders. 86. Magnetic resonance imaging, MRI, a non-invasive imaging technique that uses magnetic fields and radio waves to create detailed images of the body's internal structures. 87. Computed tomography, CT, a diagnostic imaging procedure that uses X-rays and computer processing to generate cross-sectional images of the body. 88. Ultrasound, a diagnostic imaging technique that uses high-frequency sound waves to create real-time images of internal organs and structures. 89. Prognosis, the predicted outcome or course of a disease, including the likelihood of recovery or progression. 90. Palliative care, medical care focused on providing relief from the symptoms, pain, and stress of a serious illness, rather than seeking a cure. 91. Rehabilitation, the process of restoring functional abilities and improving quality of life after an illness, injury, or surgery. 92. Radiologist, a physician who specializes in interpreting medical images such as X-rays, CT scans, and MRI scans to diagnose and treat diseases. 93. Pathologist, a physician who examines tissues, cells, and body fluids to diagnose diseases and determine the nature and causes of illnesses. 94. Anesthesiologist, a physician who specializes in administering anesthesia and managing the patient's pain during surgical procedures. 95. Geriatrician, a physician who specializes in the care of elderly patients, addressing age-related medical conditions and promoting healthy aging. 96. Neonatologist, a physician who specializes in the medical care of newborn infants, especially those who are premature or have complex medical conditions. 97. Hematologist, a physician who specializes in the diagnosis and treatment of blood disorders and diseases, including leukemia and anemia. 98. Gynecologist, a physician who specializes in the health and diseases of the female reproductive system. 99. Nephrologist, a physician who specializes in the diagnosis and treatment of kidney disorders and diseases. 100. Pulmonologist, a physician who specializes in the diagnosis and treatment of respiratory system disorders, including asthma and chronic obstructive pulmonary disease (COPD).